Hello everyone, I'm Renee Lobo and welcome to ITV Live. Today my guests are all going to be talking about the Health Expo that's coming up on Sunday, September 30th from 10 a.m. to 3 p.m. at the Gujarati Samaj in Queens. And this is the 24th annual Health Expo, and these doctors have been doing it year after year for a great cause. And it's all free, so you can take, this is a great opportunity for especially those who are not insured and even other people who would like to come. This is a great way, so stop by that day. Telling us all about it, we have Dr. Dharia, and he's been here many times on our show. I would not say 24 years, but pretty much all the time, because he's the chairman of the Health Expo. And Dr. Dharia has some great credentials. He's a very senior surgeon, medical doctor for about 40 years of experience in this country. He's associated with Gujarati Samaj of New York for many years, and he's the chair of the Health Committee conducting Health Awareness Expo every year, year after, as I mentioned to you. And he's also the trustee of the Viraj Temple, and this is the only extensive health expo that's conducted free by any organization right now. And Dr. Dharia and we're really very proud to say that he's listed as one of the top 100 surgeons in New York listing. So thank you very much, and congratulations for keeping that listing up as well.
Sure.
And joining Dr. Dharia is Dr. Nilesh Soni, and he's been here many times on our show, and he is part of the Health Committee for the Health Awareness Expo. And Dr. Soni is a doctorate in physical therapy, and he specializes in geriatrics, which is so very important, especially in physical therapy. And he has been on the Health Committee of Gujarati Samaj for more than 6 years. And besides Gujarati Samaj, Dr. Soni is a current in charge of Milan. This is a program for South Asian seniors conducted by Herix Indo-US in the town of North Hempstead in Long Island. He's also on the advisory board for Vaishnav Temple Seniors and is a consultant for India House, again, that is for seniors. He has been working in New York area for 17 years towards the care of the elderly, and he's out physical therapy centers in Queens, New York. So there are quite a few centers that you work with, and you've been on our shows many times, especially for physical therapy for seniors. So thank you very much, Dr. Dharia and Dr. Soni. So tell us a little bit about this Health Expo. You know, it's been on, so tell us a little bit more about the background, if anybody would like to come, how they go about it.
Sure. Good evening and glad to be here, Renu. The 24th Health Awareness Expo is conducted by the Gujarati Samaj of New York, right. And it's located off 173-15 Horace Harding Expressway. Mm-hmm. We are having it on the Sunday, 30th September from 10 a.m. to 3 p.m. Right. And it's very well received by the community. We have approximately 300 people coming and visiting it every year. Right. So it's a great chance for our community members to come and learn about their health, be aware of the recent changes which is going in our South Asian community, right, and benefit out of it.
That's great. And Dr. Dharia, tell us why it's called Health Expo, and is there, it's free of charge, I know that, and I think nobody's legal status is checked at that point of time.
Exactly. This is completely free. Nobody will ask anything about the insurance card or any fees or anything. This is totally free for everybody, and anybody can come. Not only Gujaratis or Indians, anybody is allowed to come here. And it is called Health Expo because there are a lot of health fairs you see everywhere, but this is extensive health fair where lots of things are done. For example, we have the blood test done right there, electrocardiogram is done, there are cardiologists taking care of that, the blood pressure is checked, the dental department is there. We have mammograms which are done 2 days, October 30th and October 7th. Special van come for that. We have also the pap smear done by them, and all other specialties are there. And besides that, there are paramedical specialties which Dr. Soni will talk to you later on. So that's why it's called Health Awareness Expo, and it's an extensive expo, and people should take advantage of it.
Right. Now, I know that you've been doing it for so many years, people know about it, and pretty much it comes around the end of September. So the date also people are very familiar with. So if you have any questions, please do give us a call. Again, this Health Expo is going to be on September 30th, which is a Sunday. It's free, completely free. Nobody's going to check anything about your status or your health insurance card. I mean, there's so many people who are uninsured. Despite the Obama Health Care Act, we're going to see still people, because it's very hard to, because of the tough financial times.
Exactly.
So have you noticed in the last couple of years who's taking advantage of this kind of expo?
Lots of visitors are taking care because they don't have insurance. Lots of seniors taking care, and as you said, uninsured people taking care of it. The people who are afraid to go to hospital because of their status,
Right.
so they are also coming there and taking advantage. And I'm proud to say that now we have lots of youngsters coming in, which is the greatest thing we could achieve.
Right.
Because they are now aware that yes, even at 20 years old, or if they are 25, something can happen to them. So it's better to get checked out.
Right. Especially the diet we are eating and the fast track, and the high pressured work that we do. Even
Exactly.
young, even 18-year-olds, teenagers are having a lot of problems. Obesity is one of the major issues.
That's right.
Could be also, you have doctors who do counseling.
Exactly. We have all kind of specialty, like I said, the cardiologist, urologist, we have general practitioners, we have internist, we have arthritis doctor, we have podiatrist, we have physical therapist, we have a psychiatrist, dental, all kind of specialties are there, GI, and they would be glad to help you out whichever way they can. So don't hesitate, just come early, and we will register you and take care of all the benefits we have in the health awareness.
So the health expo starts at 10 a.m., but they should come early for registration.
Exactly, because lots of people come and take advantage of this. So I would suggest you should come maybe 8:30. The reason is because you will stand in line,
Right.
and you will be given a chart and you will be registered. Once you are registered, 10 o'clock is the opening ceremony will start. You come in, and then you will be triaged by doctors.
Right.
They will check your pressure and weight and everything, and they will ask you questions and then decide what you need. So if you need a blood test, urine test, if you need a cardiogram, if you need an eye checkup, if you need a mammogram, if you need to see the dental, so many departments, if you want to see, everything will be checked, and because you came early, you will be able to achieve that thing.
So you have triage facilities, like somebody wants this, so you give them a different band?
No, on the chart we write down what test you are allowed to do, and the volunteers are there
Right.
to help you out and direct you where you have to go to do different kind of test or see different kind of
Now, do
specialties.
they have to bring the medical reports? Let's say some did have something, a pre-existing condition, so they can bring the reports.
Yes,
so this
they
is
can
easy
bring
for
their
you.
report so that medical doctor can check it and tell you, yes, you need this, you need that, and this is what you're supposed to do.
Right, right. Now, do you also, you have mammograms, we know that, and for that is always the Rekha Trivedi who takes care of, for
Appointments
registration,
ahead of time,
appointments
right.
ahead of time, because that's, a lot of people come in for
Exactly.
that. Do you have any other for cancer screening, like, prostate screening?
Yes, we are also doing cancer screening in men, prostate screening, colorectal
I see.
screening, oral cancer screening is done. In female, besides the colorectal and the oral screening in the mouth, the breast cancer screening and the cervical cancer screening, like a uterus and the cervix screening, they do the pap smear and screen that too.
Now, what about the reports? They don't get it right away.
Okay, the reports go to the laboratory, so it takes time, but within 2 weeks we mail the reports
I see.
to all the members who has done the test.
Okay.
If something is really critical, we even give them a call
I see.
so that they can be aware of it faster and see the doctor right away.
Yeah. In your past experience, have you seen a lot of critical cases as well?
Yes, so many critical cases, and people thank us because they were able to take care of it very early, and that saved their life.
That's
For example, very bad kind of glaucoma. Some patients
I see.
were transferred from the health expo directly to the hospital, and they were taken care right away.
Right.
Another friend of mine, his father came from India, and they brought him there for checkup. And from the blood test and the checkup, he found out he had a cancer of the prostate.
Oh.
So right away, he was taken care, and then he was cured. So he was very, very happy about that.
The important thing is early detection.
Exactly.
Many times, that can help you to resolve, many times issues that can go out of control.
So that's where it comes in. Mr. Health Expo it can be useful for prevention. So
Right.
you can use this tool to prevent diseases. And as Dr. Daria just suggested, that even simple screening can identify bigger issues within your body. So it's a great opportunity to use this expo for prevention.
Right. So that's very important. Again, if you have any issues, give us a call. Let us know. We'll be more than happy with the doctors to, provide answers for all those questions you may have. Now, besides that, you do have any educational seminar, because it's so very important these days. With early detection, you need to educate and create awareness of so many ailments that go on.
Right. Now, if you don't mind, I just want to interrupt. Do we have a telephone number they can call here?
Yes. The
We
number
put it
to
there?
call is 718-706-7872. You can just put the number up there, and then we can continue with that. So give us a call at the number that's on the screen coming up. Not this number, this is the Gujarati number that's coming up. That's Gujarati Samaj number, 718-468-9777. That's the Gujarati Samaj number. So if you have any issues that day, you can always call. But if you want to call us today, that's the number that's coming up right now, 784-3232 or 361-5999. Or if you're in New Jersey, the other number's there too. So let us know if you have any questions. They're both doctors right here. And again, we just want to tell our viewers it's September 30th, so avail this opportunity, which is so very important these days, especially when a lot of times people have health insurance, they don't have the time to go to the doctor. It's a Sunday, so they can just, swing by and see what's wrong with them and, get a blood test. Because I know, Dr. Dari, many times in South Asian countries, people are afraid to go to a doctor
Exactly.
unless something hits them,
That's right.
big
That's
time.
absolutely right. Yeah.
And I think it's in our culture sometimes
Right.
not to go for prevention.
Unless
I'm
something
fine, everything is
happens.
okay, nothing happens, But
Right.
this is more important. So this is a
Now,
great way.
that's why I said before that because youngsters are keep coming, because now they know that
Right.
they are not immune, nothing is going to happen. It has changed, which is very good, because lots of young people have a lot of heart problems too,
Right.
because of the diet
True.
and the American style of living.
Yes.
So all those things can be detected early and can be taken care.
So you have these educational seminars
Right.
too.
Now to instruct or help everybody and give them some knowledge, we have a speakers on a common problems, which are also we are getting younger speakers too.
Right.
So they are also involved, and they can give all the people who are sitting there
Right.
lots of knowledge, which is very difficult to get.
True.
And it's moderated by Dr. Chandravadan Shah. For example, we have the first one is common eye problems, and that is by Dr. Neeta Mehta. Then we have a family history and health. If you have a family history of heart disease, if you have family history of arthritis, family history of diabetes, so what do you do about it,
Right.
and what kind of health? So that we have a recently graduated Dr. Neeraj Patel, and he's an excellent doctor, so he will advise us about that. And then we have one of our committee member talking about over-the-counter medications, Dr. Himanshu Pandya. Because people just take Tylenol, Advil, whatever medicine is available, they say, oh, we don't need prescription. But there are lots of side effects and the benefits. So he's going to tell us about it, that what you should take, what you should be aware of it and everything. He's a very good internist who would take care of that. So that seminar is conducted between 12:30 and 1:30. So please attend. This is very, very important, and it will help you a lot.
Yes, because we need a lot of education on this. As you talked, over-the-counter medications, a lot of people just keep popping pills in their mouth, not knowing the adverse reactions